Hi everyone, good afternoon. I'm Dr. Akhila, consultant fertility specialist, Sudha Hospital Fertility Center, Banjara Hills, Hyderabad. Today we're going to talk about when to consult an IVF specialist. So let's first understand what is infertility before we get there. So, infertility would mean not being able to conceive after regular unprotected intercourse for a period of 12 months. Normally, around 80 to 90% of the people usually conceive naturally. When you take them for a period of 1 year, they usually conceive. But there are about 10% of the people who don't conceive. And we need to find out what is the reason behind this and try to give them a treatment. So these are the 10% of the people who need to consult an IVF specialist to be able to conceive pregnancy. And there are, like I always say, fertility is not just a woman's problem, but being infertile is a couple's problem. So we need to look into both the man and the woman and determine their cause of infertility and give treatment accordingly. So treatment basically depends on the test results, the duration of their married life, couple's choice, and these are some of the things that we need to take into consideration along with their baseline health of the man and the woman. Now let's quickly understand the different reasons why we should consult an IVF specialist or a fertility specialist. Coming to the man first, abnormalities in semen analysis is something that determines the fertility potential of a man. So, any abnormalities in these, that is, abnormalities in the count, which, if it is less than 16 million per ml, or the motility less than total motility of less than 40%, or a progressive motility of less than 30%, or the morphology less than 4%. These are some of the parameters in the semen analysis. If they're abnormal, we need to consult a specialist to figure out what to do and what kind of treatment options are available. Also, men with ejaculatory erectile dysfunctions, these are some of the people that need to consult a specialist. Coming to some aspects in women who need to consult an IVF specialist, one of the conditions is polycystic ovarian syndrome. This is one of the most common causes of infertility in women. Now, this is a hormonal disorder, and what typically happens is these women have multiple small eggs, and naturally, one egg that needs to ovulate doesn't happen. So, we need to give appropriate treatment in the form of medicines or injections to be able to grow that one egg and to get it to rupture, which we technically call as ovulation. So this is one of the important conditions where you can predict PCOS by not getting regular cycles because she's not ovulating. These are the women who need to consult an IVF specialist. The second important cause is endometriosis, where the tissue that lines the uterus, it's found elsewhere. So that is what we call as endometriosis, that is outside the uterus. That tissue, endometrium, can be seen on the ovaries or in the other ligaments. So these women are labeled as women with endometriosis, and some of these women have symptoms which you need to cater treatment accordingly. Some come only for fertility, so surgery and medical options are available for these women. The other important aspect is tubal factors, that is blocked tubes or tubes which are not healthy, swollen tubes like hydrosalpinx. All these are some of the conditions that can cause fertility issues in women that need to be addressed. Fibroids in women. So these are some of the benign tumors which grow in the muscle of the uterus that we call as myometrium. So these fibroids, some women may conceive with fibroids as well. So the treatment is individualized. and it depends on how big the fibroids are, where are they located, and what symptoms the woman has because of these fibroids. All these factors put together, the treatment is catered to accordingly. So women with fibroids can also consult a fertility specialist if they're unable to conceive. uh, there is an entity called as premature ovarian insufficiency, which means women who stop getting periods less than 40 years of age. So these are some of the women who, if we actually give them treatment earlier, it'll be much better, because eggs are something that keep coming down with increase in age. So by the time they reach 40, they may not be having sufficient number of eggs, and one of the only treatment option is probably an egg donation in women with this condition. Women who are more than 40 years of age, the fertility options are a little less in women more than 40 years of age, because the egg number comes down. Not only the number, the quality of the egg is also less at this age. So these two aspects can be taken into consideration, and women more than 40 years, the treatment options are less, but we still can, based on the scan findings, based on the test results, we can offer treatment accordingly. And in these kind of women, there is an option of pre-genetic testing that we do to prevent miscarriages, which can happen because of aneuploidies that usually occur because of an advanced egg age. These are some of the important conditions. Also, very importantly, the age. Women who are less than 35 years of age, after having tried for a period of 1 year with regular unprotected intercourse, if they don't conceive, they are the ones who should visit a fertility specialist. Also, if the woman is more than 35 years of age, within 6 months, she can consult a fertility specialist. If any of these other problems are already there, the ones that I have mentioned, they can seek a consultation with a fertility specialist at the earliest. Thyroid diseases are some of the other conditions which affect almost 8% of the women. Now, 60% of these women don't really know that they actually have a thyroid issue. So, these thyroid issues can be sorted out medically, and they must consult an IVF endocrinologist or a special IVF specialist to be able to get treatment accordingly. And some of these most of these conditions are something that I have already mentioned. So any woman who falls into one of these categories can consult an IVF specialist at the earliest and get treatment accordingly. And women with cancers also can seek treatment with a fertility specialist. Cancer treatments include chemotherapy, radiotherapies, and surgeries. So, some of these are detrimental to the eggs and the ovaries, especially the chemotherapy and the radiotherapy. So, women can preserve their fertility if they seek treatment early and preserve their oocytes. This also is applicable to men as well. They can do their sperm freezing. This is called as fertility preservation, and we must be aware that this facility is available, and we can preserve fertility by taking necessary steps well in advance. And women who have already undergone treatment for cancers can consult a fertility specialist to understand what are the fertility options that are still available with her. um, these are some of the conditions. Women with multiple miscarriages, though this is typically not an infertility issue, but more than two miscarriages is something that you need to consult an IVF specialist for, to understand why this is happening and what treatment options can be given. So, most often this occurs because of genetic problems or immunological problems or anatomical issues. So, accordingly, the treatment can be given to these women. Having understood the different categories and the different causes and who should technically go to an IVF specialist, let us also understand what typically happens in the first visit with your IVF specialist. So that visit is usually a prolonged visit because we get into the details of the history. A complete history is taken with respect to the general history, the menstrual history, the past history. All details are taken into account before we actually cater treatment to the couple. It also includes a pelvic examination and a transvaginal ultrasound. So this is also quite an integral part of the first visit that you normally have with an IVF specialist. And it also includes counseling, the different treatment options that are available to the couple, and how best we can cater the treatment to the couple. All this is understood in the first visit, along with the financial counseling that goes into the first visit. The plan is made, and henceforth, the next visit, the tests are reviewed, and the different options are discussed with the couple. So, this is what typically happens in the first visit with your IVF specialist. So, I guess this is all that you should know about when to consult an IVF specialist and what happens in your first visit. Um, any questions, please? So, one of the first questions is, what do people not understand about early consultation? Okay, I'll get to the age after this question. So, early consultation is very important because eggs are something that uh, decrease with the age of the woman and with time. So, conditions like premature ovarian insufficiency, if we do an early AMH, if we pick up these women who are in their borderline reserve before they actually go into premature insufficiency stage, we can cater them a better treatment option instead of going ahead for a donor gamete option for these kind of women. Also, with increasing age, the egg quality, the egg number comes down. So it's always the early, the better. Uh, the next question, what happens during a consultation? So typically, the first consultation is one of the most important consultations. It is fertility treatment is an emotional and a financial journey for the couple. So we try to understand the couple, the history, the detailed history is taken, a few tests are done, an ultrasound, a pelvic examination, and a transvaginal ultrasound is also performed. And importantly, we try to understand the couple to be able to give them a good, appropriate treatment. How do you know when to see a doctor about IVF? So these are some of the conditions that I have already taken through. But in brief, if a woman is less than 35 years of age and she's not able to conceive in a period of 1 year with regular unprotected intercourse. Now, regular unprotected intercourse would mean at least 3 or 4 times in a week, especially in the fertile period. So, if this doesn't happen, then the couple must go to a fertility specialist. If the woman is more than 35 years, then within 6 months, they should see a fertility expert. What should you do before seeing a fertility specialist? So, healthy diet and exercise is something we can do before we see the fertility expert. Also, carrying their medical records is very helpful, so we can understand if you've had previous laparoscopies or hysteroscopies, previous IVF treatments, or any other kind of treatments. If you can carry these records with you, it is very helpful. So your future treatment can take into consideration what has happened in the past and the best treatment plan can be offered to you uh, if this can be done. Does age affect when you should see a doctor for IVF? Yes, because as the woman grows older, the number of eggs and the quality both keep coming down. And the early, the better is always true. As I have said, less than 35 years of age, within 1 year of regular unprotected intercourse, if she doesn't conceive, that's when they should go. And more than 35 years of age, within 6 months, they should consult a fertility specialist. Also, in advanced age, I have already mentioned, there's something called as pre-genetic testing. That is the testing of an embryo. What happens is, once the age increases, the oocyte age increases, that causes infertility or even miscarriages. Miscarriages most often happen because of aneuploidies. So when we go in for pre-genetic testing, the embryo is tested for its genetic potential, and these kind of embryos, the chance of a euploid, that is genetically tested embryo, to give you a pregnancy is almost about 60 to 70%. So age does play a role. Any other questions, please? Thank you.